Hello and welcome to NAFDAC and your else. My name is Tosin Omolaja, and here's where we bring you up to date with NAFDAC's activities with regards to its mandate of safeguarding the health of the nation. Thanks for joining us for another insightful edition of the program. On today's edition of the program, we will discuss the prevailing menace of drug abuse and alcohol abuse in the country and how the agency is tackling this problem on various fronts. House NAFDAC has made and continues to record notable success in the interception of tramadol at our various borders across the country, air, sea and land. The agency's investigation and intelligence activities show that merchants of these products continue to come up with inventive ways of disguising these dangerous items. But NAFDAC is relentless and continue to be steps ahead of these merchants of death.
What happened with tramadol is that the Indian government changed their rule to make sure that tramadol doesn't get out as they were getting out before. And that is the results of what we are doing right now, destroying the containers or the tramadol in the containers. What surprised us in the agency is that we started seeing the same packaging that tramadol has for diclofenac. Diclofenac is an anti-inflammatory drug. It has an analgesic effect, meaning it can take care of pain. If there's a swelling, it can make the swelling to go down because it's due to inflammation. And I was alarmed because I worked on diclofenac in my lab for about 10 years. And I know the side effects of diclofenac. It's an anti-inflammatory drug that has 3 strengths: 25 milligram, 50 milligram, 75 milligram. Usually, if you just having little pains here and there, you use 25 milligram, but you cannot use it for a long time because it causes erosion of the gastrointestinal tract, stomach, intestine, and whatnot. If you have very severe pain, you can use 50 milligram, but for a limited time. If it is 75, it means that you are in the hospital, and they will just prescribe it for like 3 days and whatnot, So when I started seeing more of diclofenac in the same type of containers or packaging that tramadol has, we became suspicious. And we now start seeing 100 milligram of diclofenac, which ordinarily is not prescribed unless it is something so severe and for a very short time. And from the Ports Inspection Department, Directorate rather, they opened up some of the tablets and it was labeled 225. So you now have 225 milligram embossed strength on a 100 milligram labeled package. And we started wondering, what is going on? There may be 2 things going on. Either somebody or people have found something that was not indicated for diclofenac now being felt when it is used at high level, or those who are manufacturing tramadol before are now deceiving people to think it is tramadol, because we tested it in the lab and it is diclofenac, but it's 100 milligram. That is so high. If people have been deceived to use diclofenac, or they think it has some effect that will make them feel high or whatever. It is not a drug that you can use every day because it burns holes into the stomach or intestine, and slowly the person will be losing blood. Slowly the person will be losing blood, and one day the person will collapse and die. So that is what is scary about diclofenac. So we are now looking critically at imports that are coming in, because these are not manufactured in Nigeria. These are all imports. Because diclofenac, if you use 100 milligram every day for 3 months, you're probably going to die faster than even tramadol. Tramadol will make you crazy and do crazy things. But it doesn't burn whole like diclofenac. That is what is scary about it. And they are bringing it in tons. But we're going to stop it, just like we are trying to do for tramadol.
The abuse of drugs has reached an almost epidemic level in the country, and NAFDAC is leading the continental charge, especially in the West African sub-region, to ensure that this menace is brought under firm control.
You have over 80,000 people who inject drugs, and you have over 380,000 Nigerians who are high-risk users of drugs. Fortunately, because of the pressure on the importing countries, particularly India, there was a tripartite meeting between Ghana, Nigeria, and India in New Delhi. And then there was also a follow-up in Lagos. And this time around, we had to invoke all the West African countries, both the Francophone and the Anglophone, so that we could look at this issue of menace. Because India reclassified tramadol from an essential medicine to a narcotics. That means that the control now is stricter and the punishment is stiffer. And the justice system is swift. And when they gave them a moratorium of 120 days to service all the outstanding procurement orders, that was when they started rushing in 225 milligram tramadol, 120 milligram tramadol, 200 milligram tramadol, and we were just seizing because there was this understanding and sharing of information and intelligence in real time. So all the containers were detected and seized at the ports of entry. All the shipping documents have been doctored. But when they looked at their database, all the shipments left India clearly and correctly declared as tramadol 225 milligram. At the ports of entry, all the documents we saw were saying it's either diclofenac, which is a non-steroidal anti-inflammatory drug, or dexamethasone. So you could see the enormity of the problem. But that reclassification in India changed the narrative, so much so that now you don't see it coming. And we also have this arrangement with India that if we issue a permit to any importer or manufacturer of tramadol, first they will have to ask for no objection from us so that we can confirm the authenticity of the permit. And then it's only after that that the shipment can be allowed to proceed.
The agency has taken a robust and multi-dimensional approach to the war on drug abuse and alcohol abuse in the country.
NAFDAC has adopted a multifaceted approach, a multidimensional approach that includes regulatory measures, public enlightenment campaign, advocacies. What NAFDAC is emphasizing, as it were, is the issue of what we call the behavior change communication. The very first thing the incumbent Director General did, Professor Mojisola Christian Adeyeye, was to quickly confront this issue, this behemoth. She confronted it by launching what we call the YADA, that is the Youth Against Drug Abuse. In other words, declaring a war against drug abuse, but using the youths as the foot soldiers in the forefront of the campaign. And that partnership with the Young Pharmacists Group, because we had to leverage on the professional skill and also acumen, and also the dexterity of the young pharmacists that are spread all over the country, so that we had to galvanize them and recruit them into the forefront of the campaign against drug abuse, so that they take charge and be able to reach out to other young ones in the country. Because if you truly also want to win this war, you have to use the youths who can also reach out to the youth population that are involved in drug abuse. And that, apart from that, we're also working closely, collaborating with the NYSC. The DG is taking it very seriously. 2 years ago, the DG paid an advocacy visit to the Director General of the NYSC, Brigadier General Shuaibu Ibrahim. And as we are at the verge of signing a new MOU now that tend to concretize the collaboration. And at the heart of this collaborative effort between NAFDAC and NYSC is the setting up of the conceptualization of NAFDAC desk that to be set up at the 774 local government areas in the country, using the youth corpers as the desk officers manning the various desks. So we are at the point of consummating that relationship. And when it takes off, it's going to be a very fantastic and novel approach towards fighting the menace of drug abuse, and also helping in other areas regulatory activities of the agency. So we are also engaging the traditional rulers, because when the drug abuse campaign was flagged off in Kano, the traditional institution was also directly involved. So we're using a multifaceted approach and trying to engage all the socialization agents in the country, the traditional institution, even the teachers, the religious institution. Some of the things we used to do in the past, trying to also bring it back on board and strengthen it, the mechanism towards winning the war against drug abuse.
We'll take a short break now. Don't go away.
The MedSafety app is the latest reporting tool introduced by the National Agency for Food, Drug Administration and Control in November 2020 as part of the Innovative Medicines Initiative project. The app is made available to the public in collaboration with World Health Organization, Uppsala Monitoring Center, Medicines and Healthcare Products Regulatory Agency, UK, and National Agency for Food, Drugs and Administration and Control, NAFDAC. The MedSafety app allows users to track safety information of medicines, vaccines and other health products, report adverse drug reaction to a medicine or vaccine, and view data on suspected side effects. When you have received your COVID-19 vaccine, you can use the MedSafety app to report any adverse reaction or side effect you may feel. The app can be used by anybody, irrespective of whether you are a medical practitioner or not. You, your family and friends, everyone can download and use the MedSafety app to report adverse drug reaction. Just search for MedSafety on Google Play Store for Android and App Store for iOS. When using the app for the first time, the user needs to select his or her region, in this case, Nigeria, and also choose the preferred language of choice. The user will then be taken to the login page where you create an account by providing your email and password, or proceed as a guest. To create an account, you are required to provide the following details: reporter type, example, physician or pharmacist, as well as their name and email address, password with at least 9 characters with 1 uppercase letter and a number. Read the privacy statement and accept. Once you are logged in, the user is presented with a number of tabs, which includes news, products and watch lists. Under the Report tab, the user can report a new suspected adverse drug reaction, ADR. On opening a new report, the user is prompted to input patient details, which include initials, sex, and date of birth. The user is then required to input details of the suspected medicine. These include suspected medicine name, other drug details such as strength, batch, dosage details. Multiple suspect drugs and concomitant drugs can be added at any time. The report can be saved and completed at a later time. A saved report can be found on pending reports and can be continued by clicking on the report and continuing from where the user stopped. Enter reaction details, reaction date and outcomes. Multiple suspects' reaction can also be added. Also, further details about the report can also be included, such as did the reaction cause prolonged hospitalization, disability, congenital anomaly, or birth defect, life-threatening results in deaths, and so on. Finally, you can also add details of any relevant medical history before submitting the report. The user receives a message on the app confirming submission and an acknowledgement in the mail for submission. Reports can be created and saved without internet connection and be sent whenever internet connection is available. The product tabs show all medicines in the NAFDAC list database. It's easier to navigate to a drug or vaccine of interest, and this data is obtained from the WHO Uppsala Monitoring Center. User can also add products of interest to their watch list to get the latest information on the drugs. All products added to the watch list can be viewed in the watch list tab. The News tab displays drug safety information by NAFDAC. This is usually up to date with drug safety information. Registered users can also edit their profile or change app settings. For more information on the app, please contact the National Pharmacovigilance Center (NPC) at NAFDAC headquarters, plot 2032, Olusegun Obasanjo Way, Wuse Zone 7, Abuja, or call 09290511110 or send email to medsafetyapp@nafdac.gov.ng or pharmacovigilance@nafdac.gov.ng.
Welcome back. If you are just joining in, you're watching NAFDAC and your rails. Alcohol abuse is another area where the agency is working relentlessly, especially for underage drinkers. NAFDAC has taken its mission right to the source and is collaborating with the Distilleries and Blenders Association of Nigeria to sensitize young people and indeed the general public about the dangers of underage drinking.
What the agency is trying to do, NAFDAC is trying to do, is to strike a balance between consumption and safeguarding public health. That is what essentially we are trying to do with this campaign, strike a balance and also ensure that the industry is in business to be able to employ people gainfully and stay in business. And just to reiterate the refrain of the industry, that why they are also interested in this campaign, which actually resonated with NAFDAC when they made that case, is that the people have to be alive to be able to patronize their business. So it is also in their own interest, corporate interest for the consumers of them to be alive and be healthy, because they need more people so that, and NAFDAC is also ensuring that they are strike a balance. So on this note, the agency is very happy, the DG is very happy that when she made this clarion call that this campaign should start last year, you actually responded to the clarion call without shifting ground despite the cost. Because to do a sensitization campaign costs cost. It's not free. So we are very happy that you have sustained the momentum and you continue to do more.
Well, this campaign is a very important campaign, collaboration, with regulators and the industry. We have Federal Ministry of Health, who is the lead ministry. We have the FCCPC, and we have NAFDAC, jointly supporting this project. And the whole idea is to reduce alcohol abuse and to also stop, not even reductions, stop underage drinking. People below the age of 18 have no business with alcohol and they shouldn't be drinking alcohol. And then for those who are even permitted, who may take alcohol if they wish, people who are above 18 years of age, excessive drinking is injurious to health.
I want to reinstate and re-emphasize that DBAN is seriously and meticulously committed to these campaigns against the background that yes, we're business concerned and we're in business to make money and profit. However, the health of our consumers is more paramount than anything else. And we're so committed to the fact that if you're not up to 18, please don't drink. And even if you're above 18, drink responsibly. That is the mantra We are committed to live with it and we will stand by it. The chairman therefore expresses sincere gratitude to all the agencies here present, NAFDAC, Ministry of Health, FCCDC. Because we are in it together, we are sure that we will conquer.
But underage drinking isn't the only health crisis the agency is working to eliminate. The widespread consumption of fake and unwholesome alcohol is also of great concern to the agency.
Some of them, what they do, they use, what is it called? They go and pick bottles. The other day, we got a lorry load of, truckload of empty bottles, which they use in producing, especially the customized bottles for some of these well-known brands. Like you have Hennessy and the rest. They go and do all that with all these bottles. So we are calling on our people to please go to the right place to make their purchases and get your receipt. Get your receipt. Get your receipt. And also, we're also talking to the nightclubs. After dispensing some of these products, they should not leave the bottles empty and all that. And we have even discovered that some of the nightclubs, they patronize these counterfeiters. They do that. So people should be careful what they consume. This is food fraud. And also, we've been working with Interpol on this. Interpol, and there's an international organization of spirits. They're also in Nigeria. We work with them. We all been working. So they have a device, a security device, which they use in differentiating the counterfeit and the fake.
As part of NAFDAC concerted effort to prevent incessant food poisoning and to safeguard the health of the nation, the agency wishes to advise the general public to take the following precautionary measures in food handling. Chemicals are not food, so do not taste with your tongue. It is dangerous to health and it can kill. It is dangerous to cook your meat with paracetamol or any drug. It can damage your liver, kidneys, or other organs. Do not ripen your fruits with calcium carbide. It can cause cancer or damage the kidneys or liver. It is dangerous to use sniper to keep insects and other flies away from any food products. Cooking does not remove sniper. Do not consume any mixture or herbal preparation that do not have NAFDAC number. It could be deadly. Too much monosodium glutamate food seasoning that comes as cube or in sachet can be dangerous to your health. Do not add any chemical to food or drink to make it sour or improve taste. Safe food. Everyone's business. NAFDAC. Safeguarding the health of the nation.
That's our package for today. Please join us again, same time, same station next week for a fresh edition. In the meantime, if you have comments, complaints, or you want to report activities of fake drugs or adulterated food product peddlers in your area, our doors are always open. You can reach NAFDAC via toll-free numbers. For inquiries, call 0700 162 3322. For complaints, call 0800 162 3322. You may also email NAFDAC at nafdac.gov.ng. If you have complaints about any form of misconduct, you can reach the Reforms Unit via email reforms@nafdac.gov.ng or call the Reforms hotlines on 0909 763 0506 or 0909 763 0507. NAFDAC, customer focused, agency minded. Remember, COVID-19 is real. Please ensure you and your family follow the safety measures as outlined by the NCDC. Stay away from crowded places as much as possible, and if you must be out there, please wear a face mask. Wash your hands regularly with soap and water and ensure you use only NAFDAC-approved alcohol-based hand sanitizers. See you next week. Stay safe.